Spinal tumors. Overview. A spinal tumor is an abnormal growth of cells in or near the spinal cord and vertebrae. In 30% of cases, the lesion originates from central nervous system cells, forming a primary spinal cord tumor. Tumors can also develop in extradural tissues, including vertebrae, cartilage, and ligaments. If abnormal cells spread to the spine from another body part, it is called a secondary tumor or metastasis. This type accounts for about 70% of spinal tumors. Primary spinal tumors are graded by growth speed. Grades 1 and 2 spinal tumors are lower grade. They grow slowly and don't spread, but can still compress spinal tissue. While grades 3 and 4 are more aggressive. They grow fast and destroy nearby tissue. Primary spinal tumors can rarely spread to other body parts. Secondary metastatic spinal tumors originating from a malignant tumor elsewhere in the body are always considered malignant and are not graded. Spinal tumor is treated in hundreds of clinics worldwide using various approaches and equipment. However, not everyone knows that the cost of treatment in different countries can vary widely, even with the same high level of quality. For example, spine tumor removal or stereotactic radiosurgery can cost twice as much in Spain and Turkey as in Latvia and Hungary, but half as much as in Germany and Singapore. In order to find the appropriate treatment conditions in advanced clinics around the world, we created the Doctor.Global service. The platform is designed to help people get a second or third opinion, choose the best clinic location, or find the right cost and treatment date. We act as an involved mediator, helping to obtain comprehensive information from clinics, translating and organizing the patient's medical records in any language, and enabling the patient to make a meaningful choice of clinic or doctor. Follow the QR code link and describe your case. We will contact you back for confirmation and immediately start searching for treatment options, considering all your wishes. Nothing is more valuable and important to us than your health. Let's get back to classification. There are 3 types of primary spinal tumors based on the location. Intramedullary tumors develop within the spinal cord and consist of neural cells. Intramedullary tumors frequently occur in the neck region. The most common types include ependymomas making up 55% of intramedullary spinal cord tumors, astrocytomas 40%, hemangioblastomas less than 3%, and gangliogliomas 1–2%. Extramedullary tumors are growths outside the cord within the protective covering known as the dura mater. The most common subtypes include meningiomas 25–30%, schwannomas 30%, neurofibroma 5–10%, and chordomas less than 5%. Extradural tumors are the most common type of primary spinal tumors originating within the vertebrae. While most extradural tumors are metastatic, a small proportion are primary tumors, which can be either benign or malignant. When it comes to metastatic tumors, they commonly originate from breast cancer, 20–25% of metastatic spinal tumors. Lung cancer, 15–20%. Prostate cancer, 10–15%. Causes and risk factors. There are 2 evidence-based risk factors for primary spinal tumors: genetic abnormalities and a family history of spinal cancer. Genetic mutations in NF1 and NF2 genes are associated with neurofibromatosis types 1 and 2, increasing the risk of spinal tumors, such as schwannomas and meningiomas, by 50%. VHL gene leads to von Hippel-Lindau disease, which can cause hemangioblastomas. Having a family history of cancer can increase an individual's risk by 20–30%. Symptoms. Spinal tumor symptoms vary depending on their location and size. The most common symptom is long-standing, localized back or neck pain that is dull and may worsen when lying down. Due to nerve root or spinal cord compression patient experience. Motor symptoms, including weakness, paralysis, loss of bowel or bladder function, and sensory symptoms such as numbness or a tingling sensation in the arms or legs. Reduced sensitivity to pain, heat, and cold. Spinal abnormalities such as curves or deformities can also be signs of spinal tumors. In cases of malignant tumors, systemic symptoms such as weight loss and fatigue may also occur. Diagnosis. The process of spinal tumor diagnosis involves clinical assessment, a review of history and physical examination to evaluate symptoms and neurological conditions. MRI of the spine. It is the gold standard for identifying tumors, offering detailed images of the spinal cord and surrounding structures. CT scan helps assess bone involvement and identify abnormalities. A biopsy is made by extracting a piece from the tumor to determine its type and grade under a microscope in the lab. Treatment. Surgery plays a crucial role in treating spinal tumors. The choice of surgical methods depends on the tumor's location, size, type, and the patient's overall health. Resection aims to completely remove the tumor, especially in benign cases or when the tumor is clearly defined and accessible. Decompression surgery relieves pressure on the spinal cord and nerves by removing parts of the vertebra, laminectomy, or other compressing elements. Stabilization surgery, often combined with decompression surgery to reinforce the spine using rods, screws, and bone grafts. If the tumor can't be removed completely, surgery may be followed by radiation therapy, chemotherapy, or both. Radiation therapy methods like conventional external beam radiation use X-rays and gamma rays to damage or destroy tumors. This treatment slows tumor growth and delays regrowth. It can eliminate remaining tumors after surgery, treat inoperable tumors, or address tumors where surgery is too risky. Radiotherapy aims to shrink cancer and relieve spinal cord pressure, reducing the risk of long-term nerve damage. Stereotactic spine radiosurgery delivers a high dose of radiation precisely to the tumor using narrow beams, maximizing the dose to the tumor while minimizing exposure to nearby healthy tissue. It is effective in 90% of radioresistant to conventional EBRT tumors. Chemotherapy uses drugs to kill cancer cells or prevent their growth. It is usually an option for advanced or unresectable tumors. It is less commonly used for primary spinal tumors but is an important treatment modality for recurrent types of intramedullary spinal tumors and metastatic disease. Other treatment modalities that are used in the treatment of spinal tumors are targeted therapy and immunotherapy. Prognosis. Primary spinal tumors generally have a higher survival rate than secondary tumors. The 5-year survival rate for these tumors can range between 70 to 90% and is influenced by the specific type and location of the tumor. Metastatic spinal tumors typically have a lower prognosis, with a 5-year survival rate ranging from 20 to 40%, depending on the origin of the primary cancer and its response to treatment. Hope you have learned something useful today. Do not forget to like this video and share with your friends. We sincerely wish good health and success to you all.